At ease, initiate. No need to be so alarmed. I'm no paladin. Now, as you are aware, you have been selected to traverse to the Mojave to aid in our other Brotherhood chapter against the current battles of the NCR. Now, while it is quite a far journey from the Commonwealth, you will be going with many of the fellow squires and knights, along with a few paladins, of course. Now, our elder wanted to ensure that you had a full neurological assessment beforehand. It's quite vital to ensure that you would be quite suitable for this mission. I have the luxury of doing this exam. Now, have you had one of these neurological assessments before, Initiate? I see. Well, there's nothing to be worried about. It is quite a simple exam. It shouldn't take too long. To begin with, we will be doing a bit of an optical exam. It is vital that you have good vision to ensure that you could not only fight against the NCR, but other issues for our Brotherhood. Anyone that doesn't align with our beliefs. Well, we will begin with the eye exam. It'll be quite simple to begin with. Please look at the tip of the stick. I will be moving it closer to you and further away. I am looking to see if you have a lazy eye or if you have any issues with your overall vision. Yes, so focus on the stick. Very good. Just focus on the tip of it. Nothing else. Give it your full attention. As it gets closer, keep focusing. Don't lose vision. Perfect. Now, Initiate, unlike many of your fellow peers, you have experienced and seen some of the battles up in front, up in personal per se. Thus, we want to ensure that no traumatic memories will develop as you do go on. As you know, we have full loyalty to the Elder. He is quite involved with our chapter over here in the Commonwealth. However, you will be following, only temporarily, but you will be following the Elder over there. It is still very important to know where your loyalties do lie, Initiate. Very good. We'll be moving on to the next little exam. I have this tool here. This will allow me to see if your overall depth perception and how it is doing. You will see a balloon, a hot air balloon back in the pre-war days. But as you look in here, it should be coming in and out of your vision. It will go blurry, then it will go in focus, and vice versa. Very good, yes. Just focus and you'll feel a small puff in air. Focus on the balloon. Very good. Perfect. Now for the other eye. Remain very still. Do not move. Just focus on the balloon, nothing more. Perfect. I will get it on my reading right here for the overall quality of not only the depth perception, but also the overall pressure of your eye. Perfect. Here's your initial. We will be then moving on to a little bit of a more up close and personal exam. I will be looking into your eye with a few different lights. It is quite faint, initiate. In the Mojave, this will be nothing in comparison. Over there in that desert, it is quite bright. So we would like to ensure that you are able to handle brighter lights and that you have proper pupil dilation. Very good. Just follow the light and look only at the light. This is a very minor test, just to ensure that you can, one, focus and that your eyes are constricting due to the additional light. Very good. Now, initiate, I will be shining a light. I want you to focus only at the light. Look at the light. And I'm just going to look into your eye right here. Just focus on the light. Very good. Are you noticing a increase in sensitivity lately? Any worries such as that? I see. The sclera, or the white part of your eye, does seem quite healthy. If you had very dehydrated scleras, very red scleras, it can cause quite extreme eye irritation, especially over in the Mojave. Very good. Now for our last little eye test, I would like you to tell me, how many fingers am I holding up? It could be 1, it could be 2, it could be 3, it could be 4 or 5. I will be holding them up, and I want you to tell me, how many am I holding up? I will be covering your left eye to begin with. So please tell me, how many fingers am I holding up? Perfect. Now for the other eye, just remain very still. Tell me how many you see. Very good, initiate. We'll be now moving on to your ears, ensuring that you have quite the adequate hearing. It is even more vital to ensure that your sense of hearing is quite adequate, whether it be a gunshot, footsteps, could be any of the above. It's important that you're able to protect not only yourself, but also your comrades around you. Yes. Now, I have a few different sounds here. This tool here is a very soft, very subtle sound. I will be shaking this, just as I did prior, just around your head. I would like you to tell me if it is on your left side or your right side. Perfect. So please close your eyes for me. Keep them closed. Keep your eyes closed. Close your eyes for me. Keep them fully closed. In the beginning, I will show you what the general sound will sound like, so you have a general idea of what you need to listen to. You will hear this around your head, on either side of your ears. Now please tell me, is this on your left side or right side? Very good. Perfect. Good job, Initiate. Now we'll be doing a very similar test. However, I will be snapping my fingers very lightly on either side of your ears. Please tell me if it is the left side or the right side. Good job, Initiate. You may open your eyes again. Thank you. We'll be doing a very similar test to that we did for your eyes. I will be looking into each side of your ear just to ensure that there is no issues of clogging any foreign objects inside of it. Yes. Perfect. So please look at my hand over here and focus on my hand. I'm going to take a bit of a look. Have you noticed any ear pain, any issues in that? Any muffling, any buzzing sounds? I see. We do tend to see some buzzing or, say, phantom sounds in some initiates, depending on where they have been stationed. Although I believe that's not the case for you, thankfully. Yeah. Quite lucky, that is. Very well. We'll be ensuring that you do not have any nerve damage, any lack of sensation, any lack of feeling within your body now. We'll begin with your face and then further move down to your arms and legs. Hold very still for me, Initiate. I'm just going to feel around your face just to get a general idea of the base feeling. I would like you to smile for me, keep the muscles very tense. Just want to feel for any lack of fullness, any issues in that regard. Very good, and try to frown for me. Perfect, thank you. And now take a deep breath in and puff out your cheeks. Very good. I'm just going to put a little bit of pressure on just to squeeze out the air. Very good. One more time. Perfect. All right. Now I would like you to keep your eyebrows frowned for me. I'll be trying to push them up. Do not allow me to do so. Very good, Initiate. Just resist. Do not allow me to push them up. Perfect. Now on the opposite, I will be trying to push your eyebrows down and I would like you to raise your eyebrows for me. Very good. Do not allow me to push them down. Lovely. Now please put your arms out. Put them out just straight. Very good. I just want to feel your hands. Make sure you don't have any onset arthritis or any issues like that, as it'll be quite difficult to do any tasks for the Brotherhood or fight for the Brotherhood if you cannot move your hands properly. Now the other hand. It does seem like you're going with quite the talented group and a prestigious paladin. So hopefully you live up to their name. Do not disappoint our elder. Very good. Now I'll be trying to push your hands up. Do not allow me to do so. Should resist. Do not allow me to pull your hands up. Very good. Now I'll be trying to push your hands down. Do not allow me to do so. Perfect. Thank you, Initiate. We will be now moving on to the overall sense of taste. We have quite a few different items for this. To begin with, it is something quite basic, something that you've commonly had. Do you take a sip, Initiate? Yes. Very good. This was purified water. The standard issued water that you will be having with your rations. It is vital that you're able to tell the difference between clean and purified water that we consume and the dirty and hazardous radiation and polluted water that we do not drink. So if you taste something that is not similar to this, it is ideal and required by protocol that you do not consume it further, as any genetic or physical mutations given by radiation, any viruses, any injections, or anything like that will be required to put you down. I'm sure your paladin in charge will. However, it is still quite ideal to know this ahead of time and not to make that mistake. We have lost many good soldiers and fighters. Very good. Now, this is something which will be a bit of a treat for you. Although you will not get to enjoy all of it, we have brought in a Nuka-Cola as an additional test. While it is typical and expected for you to know what this tastes like, it is also quite necessary for you to understand and recognize. It has quite a sweet smell, if you can see. The one thing with the Nuka-Colas is that while we do not issue them ourselves, they are items you can commonly scavenge around the Mojave to ensure that you still get your hydration in. Yes, while they may have some different bottles, more of a rocket ship shape, more of a different styled bottle. They were all still Nuka-Colas in the end, and still quite beneficial to have. Very good. Now I like to take a sip of it to recognize the taste. Again, while they are not standard issued items, we do recommend grabbing them if you do see them out there. Perfect. Thank you. Again, this is something that is quite common in the Mojave. Very good. Now there is one more thing we would like you to taste. This is something that you should recognize the flavor of. You should be able to differentiate between the others that are less so ideal. This is something that may or may not be as common. Take a sip. What did that taste like? Be able to recognize the flavor. I see. Well, I won't get too after you for not being correct. That was sunset sarsaparilla. It isn't something as common we have in the Commonwealth here. However, over in the West, it is quite common. Something like that, especially in the Mojave, is not unlikely. While we do prefer Nuka-Cola over here in the Commonwealth, it is still something which is quite safe to consume. Very good. Now we do have a few other tests left. The first one will be just taking a quick check for your oral palate. So I will get you to open your mouth for me. Very good. And just say "aw." I'll be pushing your tongue down with the stick. Say "aw." Very good. There does seem to be some redness at the back of your throat, which isn't too uncommon. However, that may cause some issues for consuming some delicacies over there. While we do have our iguana meat here, they have a few different other food options which we don't have as much of. Yes, very good. Now, initiate. We will be taking your final vitals just before you do go out, just to see any before and after effects of your mission, per se. Very good. I will take your vitals first, so give me your hand. I will also be taking the overall blood pressure, just to see if you have a spike in anything. Very good. See here. Have that connected here. Let's see. Very good. Nothing too alarming. You should be fine to participate in standard events. While I will not be testing your physical capability or the direct need for your running, for your shooting and aiming skills, we will have one other, either a paladin, a knight, one of the instructors to look over and ensure that you are still quite capable. However, given that you have been selected for this mission, I'm quite confident in that. Very good. Now, initiate. This is a quick reminder. of the medication and the approved chem use, we have a few here selected that you can bring with you in your first aid medical kit. The first one that you will notice is Med-X. This is used to increase your durability per se. You should be able to handle quite a few more hits, quite a few more attacks, and defend a bit more. Very good. Additionally, we do have the buff out, which we do supply occasionally, given specific standards. However, your paladin will be the one to initiate it and supply if needed. Yes. Additionally, we always have the Rad-X. These are medication you can take to prevent and limit the radiation from extended exposure. Ideally, you take this prior to the radiation being present. These pills will be able to allow us safer travel. If you do have to end up drinking any radiated water, we highly recommend that you do try to purify it. However, if it's not able to and it's not possible at the timing, we do recommend taking a Rad-X beforehand. Yes. And of course, while we do not idealize or require or wish for you to use any of these chems, which are not needed, mind you, these are only in case of severe emergencies. Similarly, the paladin is issued the buff out to either share or use themselves, giving their best judgment. Yes. We do expect you to fully listen to the paladin and ensure that you do bring glory and victory to the elder, or we will not disappoint our elder. Very good. Well, you will be sent out shortly to the Brotherhood over in the Mojave and in New Vegas. We look forward to seeing and hearing back from you of your great and victorious battles. Again, initiate, always remain loyal to the Brotherhood, for we are the correct way. Very good. Is there any other questions or concerns you have for me, initiate? Very good. Well, I will jot down your final marking for this. If you have any questions or worries, feel free to let us know before you do head out. Ensure your safety and overall well-being is highly kept. I believe you'll be heading out quite shortly, so do rest up before you continue. Ensure that you do not make any mistakes out there. Lovely. Well, ad victoriam, initiate, and good luck.